We have with us Mary Charlton from the University of Iowa. She'll be looking at cancer data and where there may be some correlation with water quality. Claire Ruby, I know many of you know her, now from Drake University, supporting data-driven actions to improve water quality and public health. And then Helen Eddy, who is Polk County's Public Health Director. She'll more broadly look at the public health benefits of natural spaces. And so with that, I'm going to turn it over to these three women, and they're going to give us some great enlightenment.
Thank you for giving me the opportunity to come and talk about what's happening with cancer in our state. My name is Mary Charlton. I'm a professor at the University of Iowa College of Public Health. I'm the director of the statewide Iowa Cancer Registry, and I'm the president of the Iowa Cancer Consortium. So all cancer all the time, and I've appreciated learning a lot about the environment today. I kind of wanted to level set that cancer is caused by, it's very multifactorial, very multifaceted. It's caused by changes to certain genes that alter the way our cells function. Some of these genetic changes occur naturally when DNA is replicated during the process of cell division. So if we all lived long enough, even if there were no environmental contaminants, no nothing, if we all lived long enough, we would all die from cancer, because our cells would make enough mistakes as we aged to do that. But that can be sped up sometimes by the result of environmental exposures that damage DNA. That could include substances like chemicals in tobacco smoke, radiation, UV rays from the sun, water, air quality, things like that. This is just a list of known carcinogens and how they connect to, this is very simplistic, many of them cause different types of cancer, but you can see that there's a lot of relationships between environmental factors known to be carcinogens and certain cancer types that I'll talk about more. So again, cancer is multifactorial. Just because a substance has been designated a carcinogen does not mean it will cause cancer. Cancer arises from a complex interplay of genetic, behavioral, and environmental factors. Many factors influence whether a person exposed to a carcinogen will develop cancer, including the amount and duration of the exposure, their genetic background, and other known risk factors like age, alcohol, diet, smoking, radiation, things like that. So an environmental factor can affect one person differently who smokes, for example, than another person who doesn't. So this is the graph that most of you have probably heard about in our Cancer in Iowa report that we put out every year. Last year, in the most recent 5-year time period, we found that Iowa had the second highest cancer incidence in the country. So that's the second highest rate of new cancer cases in the United States, and that is age adjusted, so it's not just because we're old. And you can see that for a long time, going back to the early 2000s, we've always been a little bit higher than the rest of the country. We lagged when the rest of the country started to decline in cancer incidence, we lagged a little bit behind them. But you can see from that yellow line that around 2012, 2013, we went in a completely different direction than the rest of the country on average, where we started to go up and the rest of the country continued to go down. So be talking about things that both may be driving that up, but also that keep us from going down like the rest of the country. A lot of people asked or brought up, well, Iowa's an agricultural state. We have a lot of risk factors here that the other states don't. So this graph just shows Iowa in the yellow, that top line, compared to all of our neighbors. And you can see we're still much higher than any of the agricultural states around us. You can see Nebraska in the red and Wisconsin in the brown have similar trends, but we're still quite a bit higher than anybody around us. Again, we rank number 2 in overall age-adjusted incidence or rate of new cases. And it's across the board of a lot of major cancer types that we rank really highly in, which again kind of shows that cancer is very multifactorial. There will be no smoking gun. There will be no one point source that is causing all these different cancers in people. For example, we ranked second in the country in oral cavity and pharyngeal cancer. Risk factors for that are alcohol, smoking, and HPV. But we do rank third in leukemia, fourth in non-Hodgkin lymphoma, fourth in esophageal cancer, fifth in melanoma, seventh in kidney, eighth in colorectal, and ninth in breast cancer. We also rank in the top 20 in other cancers like uterine, bladder, brain, lung, prostate, pancreatic, and thyroid cancer. So it's not just one cancer with one type of exposure. We also see differences by race in our state, with the highest incidence rate among our Black population. So the cancers highlighted in yellow are the ones that have some link to environmental factors, as stated by the CDC and the NCI: leukemia, melanoma, kidney, uterine, bladder, lung, and thyroid cancer. But there's also a lot of these cancers that are more or less linked to behavioral risk factors. Now, that's not to say that environmental factors don't have any sort of role in these, but it just shows that we have like this mix of cancers that were really high in across the board. So we looked back at our kind of behavioral risk factor surveillance system type data to figure out where are we off, because people kept saying, including me, why Iowa? How could that possibly be? You know, most maps of health show the red, the bad always shows up in Mississippi, Arkansas, Alabama, the South, so why Iowa here? And we're not really that off from a lot of other states in our behavioral profile. We are 21st, so pretty average in obesity prevalence, which is increasing. And over to the far right, we're in the second lowest quartile for the percent engaging in the recommended amount of physical activity per week. So those are issues, but not very far off of other states on average. We do drink a lot here, do have a lot of alcohol exposure, and a lot of people don't even realize there's a link between alcohol and cancer, but there certainly is. And we're pretty average in our smoking rate at 16%. We do have above average or average screening rates, because a lot of people ask, well, are we just screening for it more? Is that why we have a lot of cancer in Iowa? And we do pretty well on screening, but our screening rates aren't going up at the same rate that our cancer is going up, so it doesn't really explain it. So at that point, I started to get flooded with questions about whether it could be the water. I think a lot of people have a lot of information. There's a lot of good reason to believe that environmental factors are contributing to our high cancer rates in Iowa. Nitrates are one topic that has come up a lot. We know that bladder cancer risk is 1.6 times higher at 5 milligrams per liter for at least 4 years compared to people who did not have that exposure. Ovarian cancer risk is twice as high, above 3 milligrams per liter for 11 years. And thyroid cancer is almost 3 times as high, at above 5 milligrams per liter for at least 5 years. And then a lot of those relationships vary by how old the person is, or whether or not they smoke, or other types of things in their environment or in their behaviors that sort of complicate that relationship. But certainly something that is important to look at. Just to orient you quickly to this graph, we compared Iowa, which is at the bottom bar each time, to the US, the other NCI cancer registries that are comparable, and then our neighboring states. And so 2 cancers with plausible links to nitrate exposure, like bladder and thyroid incidence, are declining slower in Iowa than the US and other Midwestern states. Again, they may not be the ones that are driving our cancer incidence up, but they may be ones that keep it from going down like the rest of the country. And as you remember from that graph, we've been high for a long time compared to the rest of the country. So you can kind of see, pointer works, but you can see that in your top left-hand corner for bladder cancer, those are all the other benchmarks of states and groups of states that are declining. And you can see we're declining significantly less in bladder cancer than other Midwestern states and the US. And down in the bottom lower right-hand corner is thyroid cancer. And you can see that our bar is actually going up. It's not statistically significantly increasing thyroid cancer, but most other states around us in the US are going down. So those are some links to be aware of. Also just wanted to show a map of Iowa that we've broken into cancer reporting zones. And we often see, this is just cancer incidence overall, but we can look by lots of different types of cancers, and we often see zones along the Mississippi River where we know that PFAS and other types of water exposures are there. We also see in that southern part of Iowa where lots of people are on well water. And so that would be, those are the types of things that we need as cancer researchers to know is more data. A lot of people aren't testing their wells. We don't know what's in the water that people are drinking in lots of parts of the state. So it's really difficult to make the correlations and make the connections and figure out what are the steps that it would take to turns Iowa's cancer incidence trends at least something towards average instead of going up while everybody else is going down. So I think I'm really grateful for all the work that everybody in this room does, and I think it's going to take all of us. It's definitely going to take a village to figure out why cancer is so high in Iowa and what the policies and programs that we can do to turn that around. So thank you very much.
Well, hi everybody. Welcome to Drake. I love being able to say I am now faculty here at Drake University in the Environmental Science and Sustainability program. Closer. Okay, there we go. Oh, that's loud. My journey, I've been working for the Department of Natural Resources for the last 20 years. I was monitoring groundwater, surface water for a lot of the contaminants that we need to understand better, as you just heard. But now I get the opportunity to teach students about all of these issues in water quality and get them out doing the sampling for us. So I'm very, very excited about that. I realize in the title of my talk I say data-driven, and then I'm not going to show you any data because I only have 10 minutes. But I'm going to talk about action. We already know data is really important to help us take the right actions, and we need to get moving. A little more than 20 years ago now, I went to India, to southern India, the state of Kerala. And in the 80s, way back in the 80s, they put in a bunch of effort to get everybody to be literate. Their literacy rate in that state in India is 99-100%, has been for decades now. They understand connections between the environment and public health. So while I was out just being a tourist, we visited a forest preserve, and we saw this sign, which you probably can't read, so I'll read it for you. It says, "Forest means water, water means life, no forest, no life. Save forest, save life." And we could substitute forest for nature here in Iowa. If we protect nature, we're protecting water. Well, what do we want our water to do? We want it to be drinkable, swimmable, fishable, and healthy. And in order to figure out if it's meeting those goals, we need data, right? So the picture on your left, there we go, is my colleague at the DNR, Matt Gresh. We spent the last 3 years out collecting data, testing public water supplies for PFAS. We learned a lot. There's a lot more to be done. In the middle is beach monitoring, looking at pathogens, looking at those things that actually make us sick. We know we have E. coli at beaches, but what are the actual risks? And then in the last picture, a couple of my students, one of them's here, testing at Easter Lake, right? They were doing microbial source tracking to figure out what sources of waste might be in the water, and they are also looking at PFAS. We have a lot of threats, right? The list is long. The thing that strikes me as most challenging in Iowa might be infrastructure. Been to 200 small towns in this state. Those operators are getting old. They're not just managing the water quality to make sure everybody has safe drinking water, but they're mowing the lawns and hanging the Christmas lights. And they don't have time to spend a whole lot of effort by themselves to understand all of the different threats, how to do source water protection, and all of that. And then all of the complicated chemistry and biology that goes into all of these different contaminants. So I have some recommendations. Some of these might be controversial, but since I don't work for the DNR anymore, I'm going to say what I want to say. So, first one, for those of you who care about water quality, I know you know about confinements, and I know you know they stink and they cause problems. But stop advocating for statewide moratoriums. It's like advocating for statewide bans on guns. It just makes people go out and buy guns and buy pigs. It just doesn't work. And it makes people perceive you as completely anti-agriculture, and it just doesn't work. So stop. E. coli is really useful, but it doesn't tell you everything we need to know. It's a good way to prioritize the work we do, but it doesn't necessarily indicate the exact risk at different locations, so we need to do a better job. Quit bashing the DNR. Thank you, Jen. I left after 20 years, and partly because morale is terrible. Those are the best jobs, and I want my students to go get jobs at the DNR. They're fantastic. I get to travel around the state for 2 years, going to different communities, looking at the parks, being in the water, testing the water, helping other folks with the water. I want my students to get those jobs. But if everybody goes out on their blogs and whatever, and they talk about how terrible the DNR is, it's not going to help. We need a lot more funding at the state level. There are not enough inspectors for those confinements. We have rules, but we don't have enough people to enforce them. We need a lot more support. Yes, we know that there's policy that needs to change. Yes, we know that at the end of the day, if you're in charge of, say, the Water Quality Bureau or the Land Quality Bureau at DNR, your boss is the governor, and there's things you can't say, right? And that trickles down to the rest of us. But every single person working there wants the water to be swimmable and fishable. They want your natural resources to be accessible and wonderful for all of you. So just quit it. I also think that the nutrient reduction strategy is an interesting tool. It's a good tool, but it's not going to solve all our problems. We need to look more locally. We need to look closer to home. And we can't wait for new rules because it might not happen for a while, and we need to get to work. So what we should do, we should insist that the DNR use their expertise to help us determine what the best solutions are. Praise them when they do good. Allison Mans, Field Office 4 Atlantic, went out after the manure spill that Chris Henning reported out in Greene County, and she worked tirelessly to prove where that manure was coming from, where that spill was, and get it cleaned up. She was out there on a Sunday, wasn't she, making sure the cleanup was happening. So there's folks that are dedicated and they're doing it right. Advocate for more funding. Fight when they want to take our data collection away. Goodness sakes. Advocate for that publicly accessible data. Do you know where the animal feeding operations are? Do you know what your water quality is? And then there are things to do at the federal level as well. We can use data to find the problem and solve the problem. I'm not looking at you yet, Pat. I'm still doing okay. All right. A really good new tool that you should all use right now, and Jonah Ventures did not pay me to do this. I should ask them for a cut. This is a company out of Colorado that will now do source tracking for you for pig, cow, human, dog, and sheep, I think, but I'm trying to get them to put raccoon on that list. But source tracking, $135 per sample. They will ship you this little container. You put extract the water with a little syringe, put it through a filter, and ship it back by U.S. mail. No ice, no storage, no expensive coolers and all the rest. And you will get source tracking results in less than a month. And that will tell you where the poop is coming from. We should all do this. My colleague Deanna and I just got a grant to build a website so we can serve the data out. So when you do it, send it to me. We'll get it out there. Thanks to Mary, we all know we should be drinking water less than 5 milligrams per liter nitrate, maybe less than 3. But if we put this as a federal MCL, it would bankrupt a lot of our small towns. But we can still have that as a goal, and we can focus. Emmanuel Padmore-Manti at Iowa State just put out data that shows that exactly what proportion of our folks are drinking high nitrate water and where they are, and that, as we expected, folks, people of color, low income, children under 5, and those over 65 are disproportionately drinking that high nitrate water. The nutrient reduction strategy is a statewide, if not Mississippi River Basin-wide goal, right? It doesn't help us focus on those source water areas where that water is coming from. So we can target those improvements, and we can protect not just from PFAS or nitrate, but pesticides and pathogens and everything else, if we focus on those areas where our drinking water is coming from. We know the nutrient reduction strategy doesn't work. Neil says it's an exercise in magical thinking. But I think the biggest problem with it, there we go, is that, I'll stop in 30 seconds, I promise, is that it's just not local enough. We need to put the effort in to make sure that our kids are drinking better water, that our kids are swimming in cleaner water. And when you look statewide and you look downstream, it's hard to sell. But everybody is drinking water in this state, and they're sending kids to school, and they should be confident that their water is okay. We can do that by focusing on the groundwater protection areas for our vulnerable wells. We already have a system in place, but we need to move faster. We need more people doing that work. It takes a little bit of science to figure out what the right actions are, but we can get there. We can do the same thing for our surface water supplies. We might get the reduction we want in the nutrient reduction strategy and not be meeting the goals of those surface water supplies. We really need to dive deeper. And for recreation, Polk County Conservation is doing great work. We know where the pathogens are. We know where they're coming from now. And we can fix some of those problems, so we should be doing that. I like to say Minnesota does it first, but we can do it better. Okay? I'm from Minnesota, I can say that. We need We need a statewide sales tax, no doubt about it, because we can't do this work without it. We know how to fix these problems, again, if we can get the work done. How do we get there? Well, we can empower everyone, especially young people. I'm looking at my students back there whose pictures, that's my daughter and her Barbie, but the rest are my students. We are putting together a podcast on 11 different deep dives into water quality in the state. It's coming soon. So far, they're fantastic, so I hope you all listen. And why do we do this? We do this because we want to get outside. We want to be in nature, us and our puppies. So Neil always ends his presentations with kids and puppies, so I learned from you, Neil. Thank you, guys.
Well, good morning. I'm Helen Eddy, Director of the Polk County Health Department. We are located about 8 blocks straight to the east of Drake campus. And I'm really, if this is a little academic, but I really want to pull back and really talk about why public health is interested in the environment and the nature and outdoors. And it goes beyond cancer, which is important, and water quality, which is important, but there are other reasons. And first of all, I want us to think a little differently about health. The World Health Organization definition of health is very, very broad. Health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. That's much broader sometimes than how we think of health. So it's multifaceted and it's complex. In addition to that statement, the World Health Organization says that the enjoyment of the highest attainable standard of health is one of the fundamental rights of every human being, without distinction of race, religion, political belief, economic or social condition. It's a right. So to be able to live up to our fullest potential in our health and well-being is a right. Okay, last definition. Well, maybe not the last definition, but what is public health? Sometimes there's a confusion about what is public health. We've gotten a lot of press lately because you know us all as contact tracers and the COVID police, but we do way more than that. Public health promotes and protects the health of all people and their communities. We use a population-based approach. We look at the whole of the community versus when you're in with your physician and they look at you and your health. We are looking at the totality of the community. And we use a prevention approach. So when we are looking at issues that we see in our community, I say we are kind of like annoying 3-year-olds. We ask why? We get one answer and we ask why again. And eventually we get down to the root causes of maybe what's causing some of these issues in our community. The academic term for that are the social determinants of health, and you will see that thrown around in public health articles and literature, and these are the conditions in which, and the environments where people are born, work, live, and play and age that affect a wide range of health, functioning, and quality of life outcomes and tasks. So that's what affects our health. Examples of the social determinants of health include, and you'll hear some that touch closer to what we're talking about today, but in public health we look at safe housing, transportation, that's something this group needs to think about, neighborhoods, racism, discrimination and violence, education, job opportunities, income, language and literacy skills, access to nutritious foods and physical activity opportunities, polluted air and water. You maybe have heard this, but 20% of our health is determined by our genetic code. 80% of our health is determined by where we live, work, and play. Another way to put that is that your zip code is a bigger determinant of your health and well-being than your genetic code. And we see this over and over again in the data. If you're looking for something interesting to go out and look at, I suggest that you pull up the CDC Social Vulnerability Index. It's a comprehensive look by zip code that will show you the impacts and what the health status and vulnerability status on this wide range of issues. And we see it over and over again. The health outcomes and life expectancy of zip code 50314, which is where I'm located, 8 blocks that way, is significantly different than the life expectancy and health outcomes of zip code 50265, where I live in West Des Moines, and 50266 in West Des Moines. Where you live matters. When we're talking about nature, and we talk about the focus on neighborhood and built environment as one of those social determinants of health, the call is to create accessible and safe environments for all people to use. By doing that, we reduce chronic disease. We can have a positive impact on mental health and social isolation. We can reduce in urban areas heat islands and storm runoff. And for me, when I look at the neighborhood that we do a lot of work in, 7-8 blocks to the east, access to nature is an equity issue. What kind of access do the people in 50314 have to a safe place to get outside and walk and play? I want to commend the city of Des Moines. They've put considerable resources into updating Evelyn K. Davis Park and adding programming so families that live around that park, 8 blocks that direction, feel that they can get outside and be safe and not deal with some of the other issues in their community. So we need to think about that. We have work to do. We've heard about cancer. We've heard about the water quality. We've all seen some of the reports. Iowa is in the top 8 states for the most obese. We're top 10. We're number 8. Not a great place to be. The color from down south in Mississippi has crept up into the Midwest. And having a safe place to get outside in nature and to move can help us address that. Lastly, I want to say, how do you engage your public health team? How do you do it? Do you know that every 5 years your local public health department has to complete a comprehensive community health needs assessment? It includes things in this social determinants of health, including the built environment. How can you get involved in that process? Meet with your public health team. We can be an ally. We may not take a lead on your project, but we can write a support letter and we can be there by your side and we can help you with the data that helps make the case for why you want to do what you want to do. Ask us for your support. So we're here as a partner and we're here by your side, having healthy and safe places for our community to get outside are very, very important, and we will not become as healthy as we can be and have the well-being and the lives that we can be if we don't work together. Thank you.
Yeah, Jim Merchant, University of Iowa. Barry, thanks for sharing some epidemiology data on nitrate. Could you comment 2 things? Farm chemicals, pesticides, particularly in associations with cancer rates. And secondly, we had an explosion of CAFOs, and I think everyone in this room realizes that. 10,000 that we know about, another 5,000 that are not registered But the issue here is, and data that's come out on this, is contribution to fine air pollution, specifically PM 2.5. It's a lot of very strong national and international data that links increases in pulmonary, cardiovascular, but also cancer rates from increases in PM 2.5. So have you looked at that in regard to our rising cancer rates, which would appear to fit with given latency, what we're seeing in our cancer rates?
Thanks, Dr. Merchant.
Thanks for that question. As you know, I'm not an environmental epidemiologist, so I'm kind of the messenger here. My predecessor, Chuck Lynch, was the PI of the Agricultural Health Study, and that's been the key source of information about the link between pesticides and cancer. So there's a lot of information out there. If you go to the Agricultural Health Study website and the numerous articles that have been written about the links between things like leukemia, lymphoma, and pesticide exposure. I think the trick with that is, again, I'm not an environmental person like you all are, but I think pesticides have changed and evolved dramatically over the decades. So what was once the makeup of a pesticide decades ago is not the same makeup as one now. So we work very closely with the Center for Health Effects of Environmental Contamination, and they are looking at that, and we're looking to link our cancer data with environmental data, also working with the National Cancer Institute to do that on a national level and be able to look at those types of things.
Thanks. Next question.
Perhaps this is a naive question, but I think this is for the lady on the right. That report that you referred to, that your community is doing every 5 years on your health and well-being, is that something that is to be documented in a newspaper, or is it, how can you get access to seeing that report?
Most of the health departments do post a link to it on their website at the Polk County Health Department. We post a link to our community health needs assessment on our website. We do ours every 3 years because we do it in conjunction with the health systems plus Polk, Dallas, and Warren counties and community partners. So we actually do it more frequently, but we do publish that report.
This is for Mary. So this is kind of a comment, but I just want your perspective. So where we live in Story County, eastern Story County Farm, we've watched in the last, I think it's what, 15 years or so, 3 young men die from cancer from 3 different families that live within a quarter mile of each other. When I see that, I think that can't be anything that's just random. What's your reaction when you hear something like that? There must be something going on.
We always encourage people who have any kind of concern about an area like that to let us know, and we can do what's called a cancer cluster investigation and see if those numbers are higher than expected. A lot of times we've done probably now 160 of those, and only 2 have ever really shown a true hotspot where we've called in the CDC. Unfortunately, cancer is actually pretty common. Now, if those are rare types of cancer and they're all the same type of cancer, that's when we get exceedingly concerned and do a more in-depth investigation. But we're always happy to look. We're always happy to work with any concerned citizen, and we'll define the geographic area that they're kind of concerned about and figure out some comparable areas that likely don't have the potential exposures that we're concerned about. And then we can do the cluster investigation. Always happy to do that. And we're, again, working with people at CHEEK, or the Center for Health Effects of Environmental Contamination, to start doing them more proactively. So we're not waiting for people to come and report those to us, but we're using the kind of mining the data and using that to identify hotspots so that we ourselves can identify those and investigate those before anybody even reports them to us. So it's a great question. We'd love to hear more about it.
Question for Claire. Could you tell us what Taylor and Kate and yourself found from the samples at Easterlake?
Maybe we should let them, but that would take too long to walk the microphone back there. Yes, so we did 2 sets of the source tracking data. It's the fall, and there hasn't been a lot of rain or transport. We found very low level hits of human indicators in Easterlake. and we tested for PFAS in Yeater Creek. We know that PFAS comes off the airport into Frink Creek and goes through Des Moines Waterworks, but this is the first time we've tested Yeater Creek, and we did find PFAS. So we are interested in following up on that to see if there's any potential PFAS in the lake itself and in the fish.
Thanks.
So, Dr. Claire, this is a question. First of all, statement. Some background. Local control was taken away on decisions about CAFOs. So that kind of local approach cannot be implemented now, county by county. Another background, 6 years ago, the Soil and Water Conservation Convention of the delegates passed a resolution in which they stated statewide there should be no-till. Now, no-till helps keep the chemicals and all in place so there's not that erosion into the streams. So when you emphasize we need more local control, your county soil and water commissioners, they don't have local control authority to say everybody in the county should be using no-till. We need to have cover crops to keep, again, the soil in place so we don't have the chemical erosion going into the streams. We don't have those local implements. Thank you.
Did you have
Well, the question was, so when you emphasize local control, can you give more details to that?
Sure, thank you. So I agree. We would all benefit from local control. I don't know, my students and I listened to the most recent Environmental Protection Commission meeting where they did vote to pass a complaint up to the Attorney General's office, but you know the impacts are local, and they're really hurting neighbors, and neighbors, you know, should have a voice. What I'm saying is that we can make improvements even without those rules in place. If you think about one of our favorite projects, right, Lake Darling, how many dollars have gone into Lake Darling for improvements for that recreational area? And we know it's surrounded by confinements, right? But we need to connect to those people spreading that manure and the water quality. We need to make those connections clear and strong and based on good data, good science. And then we need to work with them to make change, regardless of whether it's the rule or not. Because those people live there and those people recreate there. And so I'm not saying, you know, we don't need rules, we do, but I've been at this 20 years, and I don't see that happening. And the folks that I saw retire when I started at the DNR, who worked on non-point source issues, looked pretty defeated too after their 20 years. So let's say we've got 40 years in and we're still gonna wait for local control, or we can go to those communities and we can tell them, you're drinking this water, you're swimming in this water, your kids play in this water, and we know what to do to fix it. And you're right, we need no-till. We need people like Lee Tesdell up by Alleman and saturated buffers. We need all of those things. We need everybody. We need cities to be doing their part too. But I'm not willing to wait for rules because I'm tired. But thank you for your question.
Seth Watkins just told me that you just answered his question, so I'm going over to the other side of the room here. Good job answering 2 for 1, Claire.
This is Jamie Byer. I'm from Central Iowa, and one of the things that comes to my mind is looking for a canary in the coal mine. What insect, what birds, what would be a good indicator to help us in determining public health? You guys have any thoughts along those lines?
I am not an ecologist, but I would say the macroinvertebrates in the water will tell you quite a bit. From there, you know, if you're looking for the base of the food chain, right? to tell you a lot about the health of the rest of your system in your streams and rivers and lakes. That would be one. I know folks who are looking at pesticides, neonicotinoids especially, and their impact on insects, and there are some connections being found there. Hi, Alex.
So we were talking about like having the community be involved in decision. How do we do this? Right, we've been voting, but I feel like we need to do more than vote. I feel like we had to say like decision that impact the community. Like this is an issue. Like even at small institutions like Drake, we have issue with voices not being heard, and even in the government, no voices of people are heard. How do we bring the people voices into a community issue like water quality stuff?
Oh, good. You can take my source water and watershed planning in a couple semesters, Alex. We all need to do a lot more stakeholder outreach. I've seen some really successful examples. Up in Decorah, Becky Ortman has led a source water protection effort up there where they involve the water operator, the community, the city council, the mayor, all of these people. And they do some good science first to figure out where the water's coming from. They look at what contaminants are out there and figure out how to address it for their local community. And it takes some time involving people in those decisions, but once the decisions are made, everybody's bought in. I feel like 10 years ago, thanks Rich, we used to do better stakeholder outreach when Pat and Rich were in charge of the DNR, and we've lost some of that. But you also need to come to the EPC meetings. Those are on Zoom, it's not hard. So I encourage everybody to attend those meetings, whatever scale, state or county or city, more often.
I'd like Helen to get to take that at the more local level, that question as well, and then we've got one more here, and I think we'll be running out of time at about that point.
Well, I'm going to look at it a little more broadly, but anytime that you are trying to build a coalition of stakeholders, you need to be ready to reframe your message and put it in terms of how it might serve their interest. And I think oftentimes we don't build our coalitions broadly enough. It's very important to include business communities and the health community, neighborhood associations. You know, those are in Des Moines. We have a very strong network of neighborhood associations. Those are people that live in these places. But that's how you grassroots advocate. But I think again, sometimes, especially in health, we're really bad. We use big words and acronyms and things, but we really need to get it down to the level of kind of what's in it for you and what's the angle, and frame that message in a way that maybe appeals to your stakeholders' hearts. So, you know, at the Polk County Health Department, we serve 500,000 people across Polk County, and I have a staff of 42. So we do all of our work with and through other people.
One last question.
The lady in the middle. Did I read the slide right that said Minnesota has a watershed action plan for everyone in Minnesota?
Yes, and that is all thanks to the Land and Water Legacy. Yes, so every HUC 10 has dedicated scientists. They have a monitoring plan that rotates between those sub-watersheds, right? So they're collecting data, not statewide all the time, but on a rotating basis. And they reevaluate those based on the data they have every 10 years, every 5 years. So in Iowa, we have a TMDL from 2008 for the Raccoon River, right? And that's the last time we took a close look. So we can't just depend on those EPA planning sort of structure. We need to be looking closer and a lot more often.
Could you speak about forever chemicals in Iowa and the impact?
I'll start, see what other folks want to say. So when we started a couple years ago going out testing for PFAS at public water supplies, my colleague Matt Gresh and I think we put on more than 50,000 miles on the state vehicle going out one community at a time and testing both their raw and finished water. What we found was that, you know, these are in a lot of different places, but this is not an ag chem, right? So these are industrial areas. This is the whole Mississippi River Valley alluvium downstream from the Cordova plant in Illinois. This is areas near airports where they've practiced firefighting. So we have quite a few communities. There's a really good report that I wrote last year on the DNR's PFAS website that shows not only where all the PFAS that we found was, but which different PFAS compounds are out there, which helps us determine what the sources are. So we can look at which different chemicals were found in those different water supplies. And we don't know yet exactly what the tie to cancer is, but there are some spatial relationships. The cancer registry is fantastic because it's down to the zip code. Now you can look at that data. It's better than at the county-wide level. We can look really closely and start to match that with some of the water quality info we have. But that's only just begun.
Just say, we're setting up kind of surveillance systems to look at those communities. We don't know the lag. We don't know when they were there and how long it would take them to lead to cancer. A lot of times it takes over a decade. So we're sort of proactively trying to set up a surveillance system in those areas, working with, again, people at CHEAT to tell us, both with PFAS and nitrates, and start to look at certain types of cancers that would make sense to be caused by those, and start to watch the rates very closely of those, but we don't know the connection right now.
One of the undercurrents of this entire panel is really to think about the fact that public health data is integral to our messaging, and we probably need to know more and support their efforts as they support ours. And with that, we are standing between you and lunch, so I'm going to turn this over to Neil Hamilton as you give them one last big round of applause.
Well, you're interested in lunch, and one of the wonderful things about Drake is how Sodexo does a great job with the food, sources local if they can, sources from some of our friends, the meat you'll be having at these various meals, much of it provided by Nyman Ranch as it was at breakfast this morning.